Well, in tonight's Ask the Doctor segment, we're sitting down with a doctor from St. Mary's. Dr. James Lee is an interventional cardiologist with St. Mary's Medical Group. We're talking about atrial fibrillation. It's an irregular heart rhythm caused by a problem with the heart's electrical system. To speak with Dr. Lee about atrial fib, just dial 858-2222. Lines are open until 6. And we're talking about atrial fibrillation in tonight's Ask the Doctor segment. I'll speak with Dr. Lee coming up next. There's a common problem that could have dire consequences. Atrial fibrillation is an irregular heartbeat, and Dr. James Lee is an interventional cardiologist with St. Mary's Medical Group. Thank you so much for being with us.
Thank you.
Yeah, we really appreciate it. First off, what causes atrial fib?
Atrial fibrillation is it's an irregular and a rapid rhythm, and it may be caused by many things. There's certain type of heart-related causes where the most common is hypertensive heart disease. You may have coronary artery disease or congestive heart failure underneath. It may be totally unrelated to the heart. If you have somebody who's had a stress to the body for some reason, like a surgery or some kind of illness, that can trigger AFib. You may have high thyroid levels or some people with obesity-related obstructive sleep apnea. Those things can all cause it.
So once you get into this irregular heartbeat, how do you get out of it?
Well, sometimes patients may spontaneously convert out of it, which is what we hope for. In that case, it would be called paroxysmal atrial fibrillation. Other patients may need to be electrically cardioverted, or some people may need medications.
Is that with the paddles?
Yeah, and it's not as scary as you may imagine. These are more controlled, where patients get sedated and then be cardioverted.
But there's medicines, right, where people can just live on these medications?
There are. There's two ways to deal with atrial fibrillation, which is one, rate control, which means because atrial fibrillation is a rapid rhythm where patients go at 100 to 170 beats per minute, we use a medication such as beta blockers to control the heart rate. Versus rhythm control, where we try to shock or use medications such as antiarrhythmics or use ablation therapies to try to convert patients out of atrial fibrillation. There's been a big trial that came out several years ago called AFFIRM, which showed that both are actually, in terms of outcome, in terms of cardiovascular, in the mortality is identical. So both are very reasonable ways to deal with AFib.
Very good. It's always nice to hear that there are treatments that work. Very good. Dr. James Lee, we certainly appreciate your time. Thanks so much for being with us tonight.
Thank you.
And that is Ask the Doctor. If you still have a question about atrial fibrillation, just pick up the phone, dial 858-2222. Dr. Lee will be taking your calls until 6 o'clock.